Well, Covax was supposed to be a COVID-19 safety net for the developing world, a global alliance to ensure poorer countries would have equal access to vaccines and not be outbid by the buying power of the rich. But in reality, it's also become a crutch to prop up stockpiles in developed countries where poor planning has left governments scrambling for supplies. Melinda Nucifora has more.
No coherent national rollout, conflicting health warnings and insufficient supplies. It's widely acknowledged that Australia's COVID-19 vaccine program has been a shambles. This week, it joined a growing list of wealthy nations dipping into the Covax stash to shore up its stock of the shots. The World Health Organisation's Covax initiative was set up to enable developing countries equitable access to vaccines. But there's a second arm of the scheme that allows wealthy nations to buy additional doses if their domestic supply falls short. Most, but not all, of the developed world has agreed not to exploit that option. In June, Britain received 530,000 doses from Covax, and Australia acquired 500,000. That means each country took delivery of more than double the allocation of jabs sent to the entire African continent that month. The Canadian government experienced such voter backlash for taking Covax supplies that it's vowed never to do it again. While richer nations dip into the stockpile, poorer countries are still waiting in line. So far, Covax has delivered less than 10% of the jabs it promised to more than 90 struggling economies. And unlike their wealthy counterparts, these countries have no choice but to wait. Melinda Nucifora, TRT World.
Morga Kamalyani is a senior health policy advisor to the People's Vaccine Alliance. She says the World Health Organization should have factored in the hoarding of vaccines by wealthier nations.
Covax was set up from the beginning with the aim of delivering enough doses to cover 20% of the population of low and low middle income countries, which of course doesn't reach it's nowhere near the figure required for herd immunity, and even that it's not on track to deliver even half that percentage. So its starting point was not really a good its target from the beginning wasn't really a good target. It's also it relied from the beginning. It did two things it didn't acknowledge. One, the fact that there isn't, or there will not be, even before vaccines were in the market, there will not be enough doses for the majority of the world population. So it should have supported initiatives to maximize production. So that's the first thing they didn't acknowledge. The second thing is they didn't really somehow consider that rich countries will hold the vaccines. This is natural. They paid the money and they wanted vaccines for themselves. So Covax, didn't say that we're not going to deliver for rich countries until we reach, let's say, 20% or even 10% of the poor countries' populations being vaccinated. They didn't say that. So now they have to give vaccines to these rich countries.